Welcome, everybody. I'm Dr. Sawsan Al-Majali. I'm a member of the Jordanian Senate and chair of the Labor and Development Committee, and I have been facilitating these dialogue sessions that have been organized by ARD. These sessions have been focusing on social protection systems in the Arab region. And we have been very lucky in the guests that we've had, whether it is decision makers from Jordan or Palestine, whether it's civil society from Iraq, Lebanon, Palestine, and Jordan, and Egypt. We've talked with research centers in the region, and we've tried to also see various perspectives, including marginalized populations and how what kind of efforts each country has done in order to reach them during this crisis. I'm very proud and honored today to introduce several of our colleagues. We have, first of all, Maha Kattaa from ILO, the International Labour Organization. We have Sven, I hope I'm not destroying your name, Sven Erik Steve from Fafo Research Foundation, and Tewodros Kebabdi from Fafo Research Foundation, Baptiste Hanquart from Jordan INGO Forum, and His Excellency Yusuf Mansur, an economist and former Minister of Economy in Jordan. I just wanted, as I said, we have already held 5 sessions related to social protection. And I wanted to try and highlight some issues that have come up in the Arab region, because we try to not only have a Jordanian focus, but an Arab region focus in these dialogues. And some of the statistics that come and data that have come out of ESCWA point out that the countries in the Arab region have spent an average of 2.5% of their GDP on social protection, excluding health, though there is significant regional variations. Less than a third of the region's labor force contributes to social security on average across the Arab states. And Jordan and Saudi Arabia maintain the highest regional average pension coverage, which is 51%. Coverage rates for women are often under half of those for men, with young women faring even worse. And as we know, in Jordan, we suffer from a very low percentage of women in the labor force. Only 27% of the region's senior citizens receive old age pensions. Average legal coverage of pension systems for population of the Arab states is about 46%, and with women less. And Jordan is the only country that has ratified the ILO Convention on Social Security in February 2014. And most Arab countries, with Jordan as an exception, do not have maternity insurance schemes in place, and the burden to pay the salary during maternity leave rests on the employer. Now, why is it important for us to talk about social protection systems? Because it is tied to poverty, it is tied to human rights, it's tied to social justice, it is tied to reaching people who are marginalized, in order for people to feel that they've had fair, equitable access to health services, education, and are being able to live a decent life. If these we cannot meet, then this will lead to insecurity, whether it's human insecurity, whether it is national insecurity, or even regional insecurity. And we can see from the Arab Spring till now, what has happened in the majority of our Arab countries are in some kind of unrest, whether it's political, economic, internal versus external. I'm going to be quiet here and ask if we can have Sven and Tewodros present, maybe talk about the recent study that you have carried out in terms of the region here and in terms of the workforce. Are you with me, Tewodros, and who would like to go first? Yeah.
We are with you. We are actually starting with Maha, who is introducing the larger initiatives. So we will try to share one slide show amongst us. So I think Maha can start.
Okay, so Maha, please go ahead. Maha, go ahead.
Thank you very much.
Excuse me, before you start, Maha, I'm wondering if I may be able to share the presentations online. Would that be possible for the moderator or for the technical people? We have one PowerPoint that I would like to share.
You can share it from your PC.
Yeah, it looks like the that function is disabled.
No, share screen.
At the bottom of your screen, there is share screen. It's a green color, I think. If you go to that, then you can share the screen that you would like, the PowerPoint.
Correct. It looks like the host has disabled that function. So if you may allow me.
Maha?
You are all allowed.
Okay, please can you try again?
Now I do. Thank you. Maha, please.
Okay, thank you very much, Tewodros. Thank you very much for inviting us to this very important discussion. We followed, personally, I followed maybe one or two of your series of discussions. So, it's indeed interesting, and there is it's a momentum now to have such discussion, although it's a bit unfortunate that we started this discussion now, but it's to come late is better than not. So what I would like here to present is the ILO Fafo regional initiative on a rapid assessment on the impact of COVID-19 on the labor market. So this initiative was discussed between ILO and Fafo since the onset of the COVID-19, and we knew that it will impact heavily the both workers and employers, of course, including enterprises, and we wanted really to be on track to see what would be the impact and how we can work together to measure the impact. Next slide, please, Tewodros. So, the main objective of this initiative is to assess the economic and labor market impact of the pandemic, which have been immediate and, of course, very significant. And, of course, as we see now, that are likely to continue beyond the immediate lockdown phase at present. So it's not only the impact of the lockdown, so it will continue, and we will see how this the impact will evolve. The other objective of this initiative is to identify the current conditions faced by enterprises, workers, individual workers, households in light of the pandemic, and also to anticipate its future impact and identify possible policy advocacy and program intervention relevant to crises in the region. Also, to achieve the first two objectives. So we agree that it shouldn't be a one-time assessment. So it should be a panel survey where we have a repetitive exercise started now, where the people are still or mostly under lockdown, and continue in other 2 or 3 rounds to be able to measure the longer term impact by using this methodology. So now I will give the floor to Tewodros to talk about more the conceptual framework and the methodology. Tewodros, you are muted, maybe.
Yes, thank you very much, Maha, and glad to be here again as part of this dialogue on social protection related issues. And as Maha mentioned, the purpose of this rapid assessment is essentially to provide the impact of the COVID-19 pandemic in the region, particularly in reference to the labor market. So beyond the immediate effects of public health, we wanted to explore what are the labor market impacts across various groups, and conceptually, the COVID crisis may impact the labor market as conceived as having both the demand and the supply side, as well as also in reference to that, we have enterprises, workers, and households. So in this context, we're looking at how the pandemic directly affects, meaning that the effect manifesting through the public health impact is one aspect, and the other dimension which we are exploring is also the policies and the measures that are taken in order to mitigate these challenges or the spread of the disease, for instance. It's not only about also containing the disease itself, but it's also about various types of measures put in place by government and other agencies in order to maintain and relieve some of the impact that on workers and enterprises. So conceptually, we're looking at various aspects. On enterprises. We start from the COVID, the current status, pre-COVID, we call it. And that refers mainly about to what extent are individuals and households, particularly in this case on enterprises, how resilient they are, impact over time, coping measures, how are they coping, and adapting aspects, adapting measures. And with a similar concept on also on workers and their associated households. So basically what has happened before the crisis began in reference to the lockdown, before the lockdown measures had been put in place, and during and after, looking at impact, coping mechanisms, measures, and also adaptive strategies adopted by the various groups. We're looking at individuals, households, and enterprises. So for the technically oriented, the empirical approach that we have followed is to look at groups across nationalities, across gender and size of enterprises when it comes to the enterprise component. And technically, since this was carried out in the context of a lockdown situation, mobilizing resources and of course face-to-face interviews and the list available is not possible to start out or to conduct what one would call a standard approach to sampling strategies. So we have to devise a bit creative ways, and that mainly refers to also to rely on what do we have at hand, and also to define the purpose of the study in a relatively narrower manner by looking at only the type of individuals, enterprises that have received support directly from the various agencies that have actually contributed to the implementation of this study. In the context of Jordan, we have worked with ILO and UNDP. So we looked at the various programs that ILO had been implementing over the past years, be it a cash for work program, be it a job seeker or job matching program. Various types of programs have had a list of individuals or even enterprises, meaning that factories or small businesses that have participated in these processes. And we looked at this database as a starting point. And the argument here is that, first of all, those that received support tend to be relatively more vulnerable. They tend to be small scale enterprises. particularly for the case, I will come back to it in a moment, for the case in Lebanon. So by examining such structures, it would allow us to understand what happens to the vulnerable communities, vulnerable workers, and enterprises that had received support as a result of COVID. So we're trying to bring, or we're trying to shed light into a rather a type of group that may have left behind. So the focus on this particular instance of vulnerable workers and small scale enterprises would help us understand about the impact of COVID for this particular group. So on enterprises, we have used ILOs and the Municipal Property Tax Database facilitated through UNDP. In Lebanon, the various enterprise lists come from the development agencies. They mentioned earlier, the study was conducted using telephone interviews ranging about 20 minutes. And we have also assessed various aspects of, I think in this discussion, in this dialogue today, we'll talk about centrally about informality. And in that regard, informality of the labor market is assessed using various indicators seen in silos, meaning that we looked at written contracts, social security registration, employment categories such as wage versus self-employment. We also examined and have indicators to see whether the job that individuals have, it's a permanent one, a temporary, and also particularly for Syrians, we looked at the status of having a work permit. And when it comes to enterprises, we examined informality from the perspective of registration status. So on the samples, we have I'm now talking about completed interviews, 1580 individuals in Jordan for the individual survey. So these are individuals selected from the databases randomly and disaggregated by gender and nationality. So we have 1580 individuals total, 40% are Syrians, the remaining 56 are Jordanians, 46% female, and the remaining men. The sample frame in which we have selected this sample contains about 37,000 individuals in Jordan. In Lebanon, we have a relatively higher number of individuals, interviews completed, 1987 individuals, 70% Syrians, 50% female, and the frame in which this has been selected from is about 14,000. So as such that we have more Syrians in the sample in the Lebanon data compared to the almost even distribution of sample we have on nationality in Jordan. When it comes to enterprises, we have completed 1190 enterprises. That includes both data collected through ILOs and also through the UNDP collaboration. And this involves both small, medium, and large enterprises. Mainly formal enterprises are what we have covered in Jordan. In Lebanon, we have covered mainly a smaller scale sample size. This is something to be expanded as we go by. But at the moment, we have 363 small scale enterprises that are tend to be informal that we have covered as part of the study. As Maha mentioned, just a reminder, this study would be, we recognize that this is the effect of COVID-19 may not be felt fully or may not have manifested yet. So this is to be considered as a baseline in which we also come back and monitor the situation as we go by going back to these same individuals and enterprises that we have covered at this stage in order to nuance and then capture the sort of effects that we are observing on both individuals, their households, and enterprises. So my colleague Svein Erik will now take us through some of the key findings. Thank you.
Yes, I'll go through this. This will just be a brief extract of some of the main findings from what we have done in Jordan and Lebanon. As what was just mentioned, I think the more interesting results will come from our follow-up studies. We will conduct a similar assessment or exercise in about 2 months, and then again 2 months after that. And because what we see now, most of the impacts, the immediate impacts are quite expected. When you close down something, then of course you will be locked out. Then the effects are quite, as I said, obvious at this moment. So one of the main objectives of this first round was also to establish a baseline for these follow-up studies that we will do in the coming months. But anyway, there are some important immediate effects that should be mentioned as well. And the first thing is, of course, that many people have been laid off, either permanently or temporarily. In total, about 50%, 47% of those who were employed before the COVID-19 pandemic started and the lockdown are now out of work. Out of these, 13% have been permanently dismissed. That means that they are not coming back to the same job again, and they have to go out on the job market as the job seekers. 18% have been temporarily laid off and are expected to go back to work when the lockdown and the situation changes, improves, hopefully. 60% were on paid leave. That's for Jordan. We also have the extract of these results. There are very few of the results that we have been publishing in the report. So for those of you who are interested in the details, we have already published one report on Jordan on the individual workers. Hopefully next week we will publish the results on enterprises from Jordan together with UNDP, and maybe today or tomorrow we will publish the results from Lebanon. So for those of you who want more baseline data and details, you have to refer to those reports. On the layoffs in Lebanon, we can compare some of the figures from Jordan with Lebanon. 86% actually have been laid off so far, compared to 47% in Jordan. And 50% of the surveyed individuals in Lebanon have been permanently laid off. That means that they are practically becoming job seekers. 34% are temporarily laid off, and only 2% were on paid leave. One of the other main findings is that the households they have a limited capacity of coping. Of course, when you are on leave or you lose your job or whatever, you also lose money, wage income. In average, that has been a decrease of 41% in wages in Jordan. And if you compare that to the fact that only 9% in total of households have savings, you understand that this is a big challenge for the households to cope. Out of those households with savings, most of them have savings that will last for less than 1 month. If you compare that to it's actually Lebanon in the next one there, it's not Jordan. Exactly. That has been an 80% decrease in wages in average. There are some more households claim that they have savings in Lebanon compared to Jordan, 11%, but it's basically, and if you look at the nationalities here, there are very, very few Syrians that have savings both in Jordan and in Lebanon. And out of these 11%, 62% say that their savings will last for less than 1 month. If we compare some of the data for the nationalities and between gender, you see that 35% of Syrians have lost their jobs compared to 17% of the Jordanians. In Lebanon, 60% of the Syrians have lost their jobs permanently compared to 39% of Lebanese. If you look at informal workers, which we also define as kind of a vulnerable group that we are particularly focusing on, 97% of them have reported decreased income in Jordan compared to 94% in Lebanon. For women, actually, they tend to work in more formal employment. And that also means that the more women than men are on paid leave. That is actually the same for Jordan and Lebanon, although there are very few women in Lebanon that are on paid leave. But if you compare the women and men, women are more in formal employment and are in that sense less affected. It's quite interesting to compare that a bit with what we also have some data on their household duties, and of course they are not out of work. They do a lot of work in homes, even though they are a bit better off in the formal labor market. Yeah, and if we look at enterprises, some of the main findings there is that about 1/3 of the enterprises in Jordan assume that they will not survive a lockdown for more than a month. In Lebanon, the same figure, it's approximately the same, 1/3 of them, 29% to be exact. Also, the 42% of the enterprises in Jordan assume that they are not able to pay salaries for an additional month, beyond 1 month from now, or when we did interviews. Approximately the same in Lebanon, 48%. One actually interesting finding at this stage is that very few enterprises are aware of any support packages. It's better in Jordan compared to Lebanon. In Jordan, 67% of the interviewed enterprises are not aware of any support packages provided by the government or other sources. In Lebanon, it's actually 82% of the enterprises are not aware of any support packages. Most enterprises have introduced some kind of precautionary measures to deal with the pandemic at the workplaces. It's approximately 20% both in Jordan and Lebanon. On the support that enterprises have received, we should still remember that 67 and 82% of the enterprises are not aware of any support packages and do not receive any support. But of the remaining, 12% of the enterprises in Jordan benefited from wage subsidies and 8% from soft loans. In Lebanon, there were very few enterprises that received any support packages at all, and they are quite evenly distributed among the different types of support. Most of them, if you can call it most of them, they receive government subsidies, subsidized pay, 60% only. So these are just some extracted examples of results. As I said, for those of you who are interested in more details, you have to refer to the report published for Jordan and the upcoming one from Lebanon in the next days.
Maha.
Thank you. I just want to maybe summarize the findings in both countries, and we try to reflect this summary in the title of both reports. So in Jordan, we call it a double crisis. I mean, we have Jordan has a refugee crisis, and now with the COVID-19, so we have double crisis, and now we see the impact on that. In Lebanon, so it's more than one. It's multi-crisis, because they have the refugee crisis, then the financial and economic crisis, and now with the pandemic COVID-19 crisis. And this also has been reflected actually in the main findings of this study, talking about those who are employed or unemployed, or those who lost their income, because I mean the country itself are in multiple crises. Now, talking about what we can propose to support and to or what we can recommend to the government to respond to this crisis. So mainly ILO at global level, we produce what we call it ILO policy framework pillars. So we have 4 pillars focusing on first stimulating the economic and employment. The second one is supporting enterprises, jobs, and income. The third one is protecting workers in the workplace. And the fourth one is relying on structured social dialogue for developing, assessing, and reviewing evidence-based solution. So under each pillar, we are also proposing some interventions, I mean, direct interventions to be implemented to respond to the crisis. For example, stimulating the economic and employment, so having a clear fiscal policy which can stimulate and create more job opportunities and create employment. In addition to other policies under supporting enterprises, jobs, and income. So we can, I mean, we are proposing, for example, to have emergency cash assistance to individuals, poor workers, vulnerable workers, in addition to cash injection to enterprises through different ways. Protecting workers in the workplace. Actually, in the study, we asked this question about what are the measures taking to protect workers in the workplace. So we still have a large percentage of enterprises where they didn't take any measures, I mean, to protect their workers. So this should be priority if now, I mean, we are going to release the lockdown. So workers, they should feel protected and feel comfortable to go back to work. So having a clear policy about protecting workers in the workplace can help also to mitigate the risk and also to respond to the crisis. Having now the fourth one, which is social dialogue. As you know, I mean, here we are talking about, again, the tripartite structure: government, workers, employers. So they need to discuss what options each country they have and how they can make use of the available resources, and also build on previous experiences, either in the region, in the country, or at global level. So, and also make sure that any policy changes should be evidence-based and should be better reflected in more comprehensive manner. Next slide, please. Now, one of the option that we are offering and we are proposing actually to the government of Jordan. So this is one example where we are talking about emergency unemployment fund for Jordan. So this is, as you know, I mean, we in Jordan, the good thing that we have a good structural mechanism for social protection and social security. So Social Security Corporation is a well-functioning system. They have well-functioning system, and we can use this system really to have a kind of a pool or an emergency fund where different stakeholders can contribute to this pool and trying to give some subsidies or wage or benefits, so we can call it whatever we want, but this can be really a kind of immediate emergency support. In Jordan, we know that we already, the government, they established different funds and for different categories. But still, for example, the one where the informal workers, mainly those, they don't have any social security coverage so far, so they are mainly working as daily wage workers, seasonal workers, casual workers, so they don't have any coverage, either Jordanian, Syrians, or migrant workers. So how we can find this umbrella for those this category, and especially based on the study and the assessment, they are the most impacted, those who are working informally and also mainly Syrians. So this is the way that we propose to have this pool of funds, so donors can contribute, government can contribute, and being able to channel this fund to the right beneficiaries. We can also make it conditional to the registration in Social Security Corporation, because here we can also contribute to moving from the informal to formal, so having a future contribution stream and collateral could be also one of the benefits to have such fund, and make it, as I said, more comprehensive, more inclusive to all workers, and not only for a specific category. So this is in nutshell, I mean, what we are proposing here. And if you have any questions, comments, so we are open to answer your questions. Thank you.
Thank you very much for this presentation and the interesting findings. I was looking at the report that has come out of ESCWA, in which they are expecting that the Arab region will be losing around 1.7 million jobs in 2020. And for a country like Jordan, where our unemployment has reached up to 19%, with unemployment for women even higher, and it's expected that more than 700,000 women will be also unemployed out of the 1.7 million. And as we know that, because I did not hear you talk about women and how they have been affected, it is really of concern for us, because the women are some of the major health workers in the COVID crisis, whether in the labs, whether as female physicians or providing nursing care, and also part of the surveillance committees. Plus, they are also the teachers and the housewives that have now a double burden at home. So I hope when we go around in the next round that you will comment on some of the gender findings that you have had in the study. I'm going to move now to Baptiste, I would hopefully you can provide us with a perspective of during our previous dialogues we've heard of the Palestinian NGOs, what they've done in Iraq, the Women of Baghdad Association, what they have done in Jordan, the Hashemite Fund, and some other organizations, JONAF, which is a coalition of humanitarian organizations in Jordan. They have also tried to be active. So where does the INGO forum fit in Jordan, and what is the role that they have been playing? I hear some rumbling from the civil society and from people in general that the UN community has not really moved as fast as it should. And we're seeing a lot of debate on the role of WHO and other UN agencies. So I'd like to hear from you in terms of the INGOs and what is the perspective that you are bringing into this COVID crisis.
Thank you very much, Maha. I'll try to be simple because it's a very complex thing. And I just want to also maybe explain a little bit, give you a little bit a context of what is the INGO community in Jordan, right? Because INGO is like civil society. Huh? Everyone has his own mandate, value, way of work, and it's a lot of debate, and it's rich, but at the same time that has some limitation. I mean, for the social protection component outside COVID, I'm talking, yeah? The main job of the INGO has been linking the cash assistance to the social protection program, but also the health and some of the legal component, right? So basically, it's like what we push for as a forum toward our member, the donors, and the UN is to try to harmonize all those things under the leadership of the government. So we have something which is equitable and there is no discrepancy, but also to avoid overlapping. So let's say that's, linking those things are very important. It's not really yet there, but we are in a very specific context. Usually most of the humanitarian actors responding to the refugee crisis do not work in countries such as Jordan because there is no need. So you have a kind of running parallel system that includes some of host community, of course, but I think there is a lot of work to do to make it more collective and to be much more efficient. But it's a heavy machine to move forward. For the COVID response, the big first priority of the member has been business continuity, meaning how we can ensure that all the cash assistance, livelihood, cash forward program, which are critical income for the refugee and for the host community, could be distributed, right? That's the thing. So almost everyone resumed those activities by working a lot through the UNHCR cash task form, but also with the MOSD on the online modality. So there was a lot of effort, a lot of small programs that were not yet moved into a credit card modality, voucher modality, everything moved a bit online, e-wallet, things like that. So they were able to at least ensure that those usually who receive some kind of support still receive support. So it's broad, right? I will have very hard time for me to tell you. Most of the UNHCR data you will find, I mean, you will find out what the partner have been doing. Outside those population, you have people that help also internship students, that were supposed to work. So they deliver those little indemnity and compensation, so to make sure they can sustain in this period, even if the internship is not happening. So basically, the main point was that how we do ensure that whatever support we were provided was maintained. And then there was some attempt to expand. And I think there was an increase around probably a couple of thousand, I would say between 2,000 to 2,500 people that were, added, mainly refugee as that's the primary target for the big cash agency. But then behind that, I mean, there was the whole health issue that was still a problem, and this is really much more related to permits to move, right? Because that was a big constraint for everyone. So business continuity. We have to say something which is, I think, very, and maybe it's time, and it will be positive because it will force us to come a bit more together, government, UN donors, and NGO and INGO, because there will be no funding. Okay, let's make it clear. We had a country which was in a difficult situation, but you know, Jordan is, I mean, by humanitarian standard, we're out of league. But there was some difficulties those last years. But now with the COVID, that might be massive, right? If you take the IMF growth evaluation, we dropped from 2.1 to minus 3.4, I guess, or 3.7. So that means that's going to be massive. We have I think we don't know yet, and we are we are scratching just now what happened during the lockdown, but what will happen in the next few months, because this will be critical. I know government managed to get a lot of people registered under the social protection. I think that was a very good progress. But I think we do need to have a much collective engagement to assess very clearly what are the resources available in the country right now, because the next 6 months is going to be very difficult. And next year, the funding will decrease. That's guaranteed, because the COVID crisis impacts everyone, right? So all the funding promise and things will diminish. So we have to, I think, play a little bit much more collective, and to really engage strong discussion with the government, and to see how far we can also harmonize the different package between the NAF and the cash assistance to refugee, and also to make sure we don't leave anyone behind, right? Because there is a couple of populations that are completely out of the response right now. And I think we need to, at least for the COVID response, pay attention to those people, so they don't, you know, it's when people are starving, they don't respect regulation. And that's a real point. So we have to make sure, because that's not I mean, I can tell you COVID is here for 1 year, 1 year and a half. We all know that. So we will have more and less lockdown, local lockdown coming up and force. But I think we have to be very much stronger, engaged collectively and have a proper plan. So that's where we are. Business continuity is there, slight increase, but very limited funding. And so, yeah, I mean, we are all very anxious for the next couple of months. Oh, we can't hear you, I think.
Sorry. Thank you, Baptiste. Yeah, this trying to to put on the mic and turn it off and so on. I think from all the dialogues that we have had, a lot of issues have come up, and here even more, that there will be less funding. Usually we used to depend in Jordan when there was a crisis on the Gulf countries, but as everybody has said, is that the Gulf countries, Europe, the United States, they are all suffering, and their economies will be suffering. And so we are sure that the funding will drop. It's about 42 billion, the estimated loss in the Arab countries. We have found other issues that have come across, and I think there are things we need to work on, and part of it would be the support of ILO, organizations such as FAFO, or the INGO forum, is the lack of data and evidence. And the question has just come, is that, have you looked at the regional distribution of the data that you have gathered? There's also what came up was that we may have emergency plans for security issues, but we may not have had in place in the Arab region health emergency plans, and that's why it took a lot of countries time to get going in terms of responding to the COVID. Plus, there are no lessons learned because everybody was in it, and there was just a couple of months lag as this disease was spreading throughout the world. This disease also showed the weakness of healthcare systems, and especially in countries that focus on the secondary and tertiary rather than the primary healthcare, and one of them is Jordan. The other thing, it showed the need for a unified leadership and people working together in collaboration. It showed the importance of technology, but at the same time, it has led to marginalization of people because of technology and their inability to access technology. We still have marginalized groups, and you have said that some of them have not been reached. We have tried in Jordan to reach even the daily workers, even foreign workers, people in prison, elderly, and so on. But I'm sure there are people out there that still have not received the support they need. A lot of other issues that have come up, such as mental health issues with these lockdowns and people not certain what's happening the next day, worried about the schooling for their children, worrying about work, worrying about making sure there's enough food that they will able to help them, especially with the lockdown of borders. Plus, you know, with Jordan, today they've given people permission up till 11 and yesterday, and people are worried at what they have seen in the marketplaces and in the shops with people not wearing gloves and masks. And the worry is that, you know, people are not abiding by social distancing or protection measures, and are we going to see spikes? And this is going to be everywhere. So I would like to ask Dr. Youssef to comment now, based on what you have heard from the ILO study, from what you've heard from Baptiste, and you have been part of our dialogues during the last few months. What is your take on the results of this study and some of the activities that the government has taken in terms of through the Social Security Fund, corporation through the central bank, working with banks, trying to help people be able to cope economically. But we know that there are still measures, whatever we do, like the tourism trade that's been shot, the airline industry has been shot. This is really even worse sources of economic issues that we're going to see for the next years or so. So please, Dr. Youssef, can you comment?
Thank you very much, Dr. Sawsan. Thank you. And I'd like to thank the speakers and the researchers for this, I think, very useful exercise. And I myself have benefited a lot from reading it. And I look forward to the next volume. Truly, the crisis could not have come at a worse time. In the 2020 government budget, there was an estimated deficit of 1.5 billion dinars, about $2.4 billion. No, about $2 billion, just slightly over $2 billion. The debt level had exceeded 96% of the GDP. There was sorry, I was reading a comment. There was we had inflation of 0.3% last year, and unemployment had edged to 19.6% in the last quarter of last year. So unemployment had been rising, and had been rising significantly in the last 4 years. We had a recession, a deep recession and a long recession for the last 10 years, as measured by the real per capita income in Jordan. So when we come in, and I did a small exercise on my own, when we come in and we say, suppose the economy in the past 3 months lost 30% of its activity, and I believe it lost more due to lockdowns and curfews, then we're looking at much more than the estimate, the loss in the GDP. That is much more than the estimate of the IMF. The government usually takes 30% of the GDP in taxes and fees. And according to the last budget, it's 10 billion out of 32 billion dinars. So go figure, if there is a decrease in economic activity of, say, 5 billion, then there is 1.7 billion decrease in the budget itself. Now we have, just before the COVID onset on Jordan, we have signed a standby arrangement with the IMF, which gives us $1.3 billion over the next 4 years. And I think a tranche has been released. The state of affairs for enterprises is that only 12.5% small enterprises. Now, if we look in Jordan, MSMEs, micro, small, medium enterprises, make about 99%, 99.6% to be precise, of companies. They contribute about 70% in terms of employment. Now, the small only received only 12.5% of them were able to access loans from banks. There is a bias toward lending to medium and large firms. So the small enterprises, which make the bulk of the economy, were facing financial burdens. They couldn't access formal financing. And I'll go into the labor force in a minute, but just to talk about the supply side, the supply side, the production part of the economy, there is the interest spread of 4.5% difference between the lending rate and the deposit interest rate, which is quite high. So the businesses have been facing hardships regarding financing. There was a 10-year recession, budget deficit, expecting a deficit of 1.5 billion dinars before the crisis. Even if we reopen the economy, it is not, it would be naive to assume that economic activity will go back to its level before the crisis, which was already low. You know, we had less than 2% actual growth last year. And so, so the expectation for this year is there should be a significant decrease in economic activity. Certain sectors, as Dr. Sawsan was pointing out, like the hospitality sector, which is significant in Jordan and contributes about $5 billion in the GDP, has come to a halt. Supply chains have been disrupted. Several hundred companies have gone to the Ministry of Labor and asked during the crisis to be able to stop work and lay off workers. Add to this that we have a labor market which is split 50-50 almost. There is 1.35 million workers that are formal, whether in the public or private, and there is 1.25 million in the informal sector. And it is expected by some measures that 0.9 million workers in the informal sector may be affected, and possibly about 10% in the formal sector, 10.5%. But if you're starting from a basis of 19.7% unemployment, you're looking at significant unemployment. So let me go now to what has been done. The Social Security Corporation has done admirable work given its resources and its capabilities. They have done some good work. And I think they were trying to take over some of the responsibilities of other institutions in order to help. And I see that in the model that you have put, that to work closely with the SSC, and that's admirable. But I think you have to take into consideration to your model that you work with NGOs, because you're basically working with an informal sector which there is no databases on. And there is one of the question was, did you look at the regions within Jordan? Because regions will be affected differently. The demographics are different. The constraints are different. The type of work, etc. They vary from one governorate into the other. We have 12 governorates. And as a result, I think civil society in Jordan, and as we see, civil society has a very important role. And as you correctly, the ILO model that was put forth, I noticed that it put registration, that the whole process starts with registering companies, and that's a good thing. But let's not make a registration, and it's an opportunity for Jordan to register these informal entities. But let's not make formalization monkey wrench process stopper, so that we don't stop the process. Let's go smartly about it. As well, since civil society as well in Jordan is very much aid dependent and donor dependent, this is an opportunity for civil society to take a major role in addressing the COVID-19 consequence. And so as you see an opportunity for formalization, I see also an opportunity for a rising role for civil society organizations in the country, because they would be more capable of addressing the local challenges, and COVID is about localization, and so is the new paradigm in development. So there has been some measures by other institutions like the Central Bank of Jordan. It allowed banks to reschedule loans. It also allowed banks to lower the interest rates. It reduced the requirements, the reserve requirements on banks. So it freed for them about 550 million dinars. There was other acts as well that availed about 1.55 billion dinars. The response we get from the street is that not all this money has gone into organizations. The literature on COVID-19 around the world is that monetary policy, which is central bank policy and actions, help countries in order not to move into a financial crisis. Of course, everybody will move into a financial crisis. As I said, the fiscal policy, the government has very little fiscal space, entering in with 1.5 billion deficit and looking at probably another 1.7, maybe more deficit, depending on how things develop, because we don't know. The health policy is guiding now the economic policy and the political policy, which is new for our thinking. So we don't know, so we need all the players to come together. For the fiscal policy, however, to become active, before I leave the monetary policy I think has more space to act, and I believe it will act more, but as well the fiscal policy is being relied upon to act like in delaying taxes, postponing payments, etc. All this would reflect on the fiscal space, especially given that since 2006, domestic revenues barely cover salaries, pensions, and debt servicing in Jordan. So, and for the rest, capital expenditures, infrastructure reform, things, we've been relying on aid. So there is a role for the international community to come in and provide aid. Jordan is a host of refugees. It is not, when we talk about 1.25 million informal workers, we're talking about refugees, we're talking about guest workers from neighboring countries, and we're talking about our Jordanian workers. And so there is a humane responsibility. We have to pay attention when we talk regionally as well. There are areas and poverty pockets around Jordan, which tend to also host more than their fair share of refugees. These, we have to make sure that when aid goes to refugees also does not alienate the host communities and create frictions like we have seen at the beginning of the receipt of our guest workers from guests from Syria. So there's a lot of roles, a lot of role for aid to be played right now, and I think there is no substitute for helping Jordan, a host of 650,000 refugees, and suffering from almost half the labor market being informal, having a budget deficit to start with. Businesses have come in, and as you showed in your study, businesses, very, very few are, I forget the percentage, but very, very few are capable of staying in business for more than 1 month. And savings have been low, of course, because of a long recession, but businesses as well have been tired and weakened by a long recession, and people's savings have for some time been depleted. And so we cannot have traditional thinking. We really have to think outside the box, and we have to come into support. I mean, this is a disease where that has, everybody says it disrupted supply chains. What do supply chains mean? I mean, supply chains mean also trade. So donor countries that help other countries are actually helping themselves, because they themselves may lose supplies from these countries if their economies were to be harmed. So we're all in this together, and I think the global community should understand that and really work on that. And even though some of them are suffering, a small economy like that of Jordan can be helped easily. We're not $1 trillion or $20 trillion economy like some. We're 32 billion dinars, hardly $50 billion. And I think we should look at smart aid, a significant amount of aid that works with civil society in order to localize, and smart solutions that go into the ground, and not just blanket solutions. This is a very, very good study. I was really, really happy to read it, and I was very impressed. And I thank you very much for having done it. It was wonderful.
Thank you, Dr. Youssef.
Thank you.
Thank you. We'll come around again and ask you even further more on the, after we hear, take another round. There's some comments and questions that we have received. Some are on the chat, but also through the Facebook. The first question comes from Dina Najjar. She's asking, any segregation by region, urban versus rural? The other question was, what about the role of social cohesion, community responses to those informal or formal workers who lost their jobs? And there is Lana who says, thank you for this presentation. I have a few questions. Building on your finding on the SMEs not being aware of support packages, I wonder whether your research includes mapping labor market policies interventions implemented by the government of Lebanon and Jordan in terms of safety measures, exceptional financing. Do you ask respondents about their access to social insurance, contributory schemes? How would the unemployment fund for Jordan ensure to include refugees and strengthen the linkages between parallel assistance and national social protection systems if the latter is even an objective? We also have from Adam Leach, he's asking, is there any assessment of the long-term impact the crisis on national capacity as well as prospects for recovery in view of the multiple crises? And Dina, is now not the time for taking a loan, make sure social protection is provided to the informal and formal sectors? And the last one, what about persons with disability workers who are afflicted even more or affected even more than other workers from COVID? So there's a lot of questions for, Tewodros and Sven and Maha. So who would like to go first to be able to respond to all these questions?
Yeah, I can perhaps take up some of the earlier questions that tends to be a bit on technicalities. Yes, when it comes to, for the question about disaggregation, I think by region versus and also urban versus rural. In Jordan, the sample that we have covered comes pretty much from all governorates, and the major ones, we have Amman, Irbid, Mafraq being the highest, and Zarqa, and we have a bit about 5% in Madaba, and around 12% with the rest of the governorate. So the intention originally was not really to disaggregate it by different governorates, but given the fact that these programs have actually sufficiently covered across these governorates, so eventually we ended up with a good sample that reflects this diversity. But it's not intended to see what happens in governorates. But that's the outcome of the randomization that has happened during the sampling. The other technical bit that refers to some of the measures and the community level responses and all of that, it's by design why we have also constructed this study as a repeated sample study, because first of all, this is done in a lockdown situation. So it was restricted movement. We pretty much observed what happens during the lockdown when there are movements have been restricted, particularly for dealing with for mitigating or reducing the spread of the disease. So now the interesting bit, as we've mentioned in the beginning, becomes more to see what happens. And as Baptiste has said or has mentioned also, this is something that's going to be, we're looking at least a year or so. If the disease is not manifesting as much as it does, at least some of the effects would linger. So it's going to be, we're here at least for the foreseeable future together. So it's important that we don't, we capture the effects fully by looking at what happens in August, what happens in October, and having this structure would help us understand a bit more about the adaptation measures taken by communities.
Okay, thank you. Sven or Maha?
Yeah, perhaps I can add something. I think you covered most of it, Tewodros. There was one question about disabled people as well, which is maybe answered in the same way as you started on, Tewodros. I think it's that would of course be interesting, but and these are certainly the vulnerable groups, if you're talking about vulnerable groups within vulnerable groups. But I think the main restriction here is that we have to do this through the phone service. If we were able to operate on the ground, this would certainly be one of the focuses. But there are restrictions actually on what we can do on this disaggregated groups. I'd also maybe take it back to, I think, many of the points and what Yusuf talked about. I think these are maybe the interesting questions to see our results and other results, actually what is happening now in reality, and try to ask the bigger questions. Because this is one interesting thing about crisis like this, whether it's COVID or could be something else, is that it exposes and increases already existing challenges in the labor market and also in society. And this is what we see now, and also the support, as Yusuf mentioned, on micro, small, medium enterprises, and the policy around this is also kind of contributing. The policy is, the vulnerability of some of these policies are also exposed during these crises, which are the more kind of interesting questions that we hope to come back to when we have conducted the follow-up studies, because then you could see the broader trend of this. And these are it will really be interesting to sit down and reflect on these bigger questions when we have done that.
You didn't talk about gender. Was that raised or something you looked at when you were analyzing your data?
Gender is one of the key dimensions that we look at. So when I was presenting, I saw also that comment. We just had to extract the main figures. So then again, I just refer to the reports that we published, and the gender is one of the main dimensions that we present.
Great. Maha, do you have any comments?
Yes.
In light of the ILO and what Jordan has done in terms of steps, yes, you have suggested this emergency fund, and as you know that we now have 3 funds, one established to support the marginalized, and they have started dispersing some of the funds the day before yesterday. We have the health fund, and we also have Himmet Watan, which is the big fund. Of course, it's not going to be easy, because as Dr. Youssef has mentioned, that we're going to be taking even more loans, and we are already in very high debt in Jordan. Plus, the economy is not working for it to bring income into the government. So that is an additional loss. The cost of the COVID plus the additional loss of the income being incapacitated. So as ILO, have you seen Jordan take appropriate steps in terms of preserving the status of the workers, but also taking care of the employers? Because it is a very difficult balance. How do you balance between keeping these enterprises going, but at the same time making sure people are at least working or having some kind of financial support?
Yeah, thank you very much for your question. I mean, I have noted also other 2 or 3 questions on that you already mentioned, but let me start with the last one, the emergency employment fund that we are proposing, and how this fits under the structure that now and the measures that the government is taking and already taken. As I already mentioned, that I mean, the government, they took great steps forward in really being very responsive, very agile to the crisis, and trying really to have emergency response. So if we compare, I mean, the 2 countries, so we see Jordan has indeed being more responsive and trying to provide some support either to the workers or to the enterprises. I mean, the way that presented, still we see it's fragmented. So we see a lot of initiatives, but we don't see yet a one umbrella. So we have, for example, through the different defense orders, starting from defense order number 1 to number 6, 9, 10, 11. So you have pieces of social protection and employment labor market measures, which is, of course, I mean, it's understandable because, I mean, the government tried to be ad hoc to have such a response, but now maybe it's time because we know that the impact will be longer than expected. So we are talking about 1.5 years. So we need really to be well prepared, taking stock of what we already proposed and implemented, and try really to I mean, merge those different measures in one policy, more comprehensive, being monitoring fiscal, stimulating the economy, creating jobs, formalization, social protection. So it could be one strategy which can respond to this crisis. Talking about the fiscal space, and I echo what Dr. Youssef said. I mean, Jordan doesn't have really the right fiscal space to cover the cost of responding to COVID-19, but also we need really to promote Jordan as one of the countries where they try to be comprehensive, inclusive, and this is why we are proposing the Emergency and Employment Fund, because most of the funds established by the government so far, talking about Jordanians, in addition to Gazian Palestinian from Gaza, or Jordanian from or children of Jordanian mothers. But what about Syrians? Because here we have an issue of being Jordan really being the example in the region, talking about the inclusive in the labor market since Jordan Compact. But now when it comes to the response to COVID-19, so a bit they are excluded. So we need really to bring back donors to Jordan to say, look, Jordan is despite the challenges they are facing really to respond to this crisis, but also they are inclusive. They are trying also to support all workers and to be to have a comprehensive package to everyone. So here we can really work together. And I also echo what Dr. Youssef said about the role of civil society, because I mean, there is a huge work now. It's not, I mean, the government will not be able really to respond to all these challenges in terms of health, social impact, employment. So they need really to have some support, and civil society, either, I mean, also NGOs, INGOs, and others can be very supportive. Just, I want to respond also to 2 questions were asked. So about the social security, of course, in Jordan, from our sample, so 63% of our respondents, and mainly Jordanians, are covered by social security, while 24% of Syrians are covered by social security in Jordan. In Lebanon, 98% of Syrians are not covered by social security, and 80%, around 69% of Lebanese, they are not covered by social security. So the situation in Lebanon is really very, very harsh. Talking about also the question to enterprises, when they said if they are aware or not, of course, I mean, we tried in the report, actually, we started opened by a first section to capture the different measures taken by the government through the different defense orders, and we tried to capture them in one question. So what are I mean, it's a multiple choices, so they can choose one or more. So most, as we mentioned, that we have good percentage still of enterprises, they are not aware of the measures taken by the government. Social cohesion, very important. I think we will have a more, it will be included starting from our second round to look at social cohesion and maybe also other dimensions like child labor, for example. Thank you.
Thank you, Maha. I'll come back to you, Dr. Youssef. One comment that I was really amazed about the enterprises and their absence of knowledge of the support packages that were offered by the government. Daily we are bombarded on the news with these, because people are going back to watching Jordan television and at 6 o'clock and 8 o'clock to see the situation and what new defense orders come out. And continuously on the television, these announcements about what kind of support. The other thing I think, sadly to say, is people wait for people to come to them. And I think people need to be proactive in seeking information about what kind of resources are there. But also there's a lot of illiteracy, technological illiteracy, in the sense that there are platforms out there, but people don't know how to access them or get to them. And I think this is where a lot of civil society can do a lot of effort, because they are in the field, they can provide this technical IT support for people to access information, funds, and so on. Before Dr. Maybe I'll take a quick comment from Dr. Youssef, and then we'll move to Baptiste. And there are two issues that I'd like you to talk about. One of them is with the dwindling funds that we are expecting for Jordan, and particularly, most likely it's going to be for the Syrian crisis, because it's been a long time and it's no longer, as I say, a sexy topic to support. So I'm sure there will be a dropping of funding. And we see some INGOs pulling out of the Syria support. And I think we will see things left to the Jordanian government and civil society. So what are you doing in terms of preparing, working, collaborating with the Jordanian civil society in order to make sure that there are some transitions for things that people are pulling out of in light of the reduced funding? The other thing is that we have the Brussels conference coming that is going to discuss future support for Syria, and what kind of efforts are being put, and how is that going to be affected by now this COVID crisis. Also, with the London Compact, there was this commitment of Jordan to make sure that 200,000 Syrians are licensed to work in Jordan. Now with this COVID crisis and with the results that we've heard from the study, the Syrians, we've had a hard time to get the Syrians to register and to get licenses, and for their employers to get these employment licenses. And now we are going to see a drop again in the efforts that were made and the challenges that somehow are new challenges have come along. So you have multiple comments, but I'll take a quick comment from Dr. Youssef, because it may be in line with the previous responses, and then we'll move to Baptiste. Dr. Youssef.
Thank you, Dr. Sawsan. When we're speaking of aid and we're talking about donor support, I'd like to take us back to the 2016 London Compact. In that London Compact, there was promises of support For instance, the EU eased the export conditions for Jordan to benefit Jordan. There was promises of investment. There was promises of investment to create work and partnerships between Syrians and Jordanians. There were a lot of promises there, and it wasn't just about getting and paying for the worker permits. So we're not asking for anything additional. We're just asking for a proper implementation of the London Compact. We should not forget the London Compact. There was a lot of support promised there, and I think, you know, the Syrian refugees, particularly women, is a very important issue. A Syrian refugee woman is probably, and a Syrian youth is probably among the most vulnerable in Jordan. Youth and women are vulnerable in Jordan, and being Syrian as well and being a refugee makes them even more vulnerable. And so we look for support from traditional donors like the EU and others, especially all the parties that were involved in the London Compact, because parts of that London Compact with the corona will not be, you know, I mean, I don't see our industries exporting right now. I don't see investments flowing in right now. So a lot of this goodwill that was presented in the London Compact should translate into direct aid to help mitigate the impact of the crisis right now. That's it.
Thank you, Dr. Youssef. And I think my worry is also that the aid that Jordan has been receiving is going to be diverted rather than supplemented. And this is a worry because we already, in terms of the Syrian crisis, the support for the Syrians is not covered. Only a fraction of it is covered by the donations, and Jordan takes the brunt of it. So now when we have this crisis, what we are seeing donors do, and even ones that we are working with, is looking at diverting the funding that is present to COVID. And so the funds that were designated for activities to support Jordanians and Syrians are now going into a different direction. So what will happen? We need supplementing rather than diversion. And I think it's going to even be worse next year. So I think this is a good lead into Baptiste's intervention. And then we'll have a last quick round with final comments from all our speakers. Baptiste, please go ahead.
Thank you very much. On the funding thing, I mean, and because this is highly related to the INGO presence and remorse of pulling out. Well, I can tell you that right now, all the INGO that are currently operating in Jordan, where, let's say more or less 40% of them are working mainly on the under the GRP, right? And then you have 30% approximately working in both. So under the Ministry of Trade and Industry for Development Program and also under the GRP, and then the remaining are pure development actors working in Jordan sometime for over the last 17 years. So their concern is very different. Their funding source is very different. Right now, there is no threat. There is no thing. In terms of reallocation we've witnessed, they were very, very small, to be very honest, because we all knew that somehow, because the government reacted strongly, quickly at the very beginning, and that was absolutely needed, and that was, I think, the right move, and we should not lose that in sight, even if the impact after was difficult on everyone, especially the most vulnerable group. But the decision, the right decision was taken at the early stage. So right now, no major reallocation or diverting fund towards something else. It's much more adapting what we are doing into online modalities, or trying to make sure that, for example, in Mafraq, that has been, hit very hard with the COVID, there was a little bit more resource. But so it's a very internal relocation from Syrian refugee to Syrian refugee, or for the same, or from some host community to other host community. No one is pulling out. Will it happen? Yes. I mean, basically what we see and what we think is that every challenge pre-existing to the COVID is and are the same. They will just dramatically increase, right? So that means we need to speed up the transition agenda. Localization is definitely a key component of that, and we are talking with Sama much more than before, I hope, and we develop much more things. For example, as you refer to Brussels, for this year, the Brussels Civil Society Consultation is not led only by the GIF, but is co-led by GIF and JONAF to make sure we have a much more comprehensive feedback from the civic society. You know, INGO being civic society is always a big question, right? Because some of those INGO are very massive organizations that are almost professional implementing head partner, right? So there is the association or engagement level is much more at the HQ level than on the field. So what we see now is that we have to speed up this agenda. We have to speed up the transition discussion, and it's a tough one because you know, integrating Syrian refugee and other refugee or other group that are not covered into a governmental policy require a massive amount of bilateral funding and also a robust civil society to accompany this movement. I mean, let's be honest, we are talking, if we want that, and I think we all do want that, that's gonna take 10 years. I'll be very realistic because based on all the experience we had in other countries, similar to Jordan, and not referring to some very low income country, right? But some like Indonesia during the tsunami, for example. You know, Indonesia is a very strong country, but moving into integrating all those services that were parallel and where basically the humanitarian were running substitution of services took a very, very, very long time because, well, it's very political and you need to have a strong will from every participant, every stakeholders, including the Jordanian government first, right? And I think this is something we need to resume dialogue. There was several dialogues. I think for the last 2 years, we were a little bit, you know, everything was a bit staggering around because, well, because we had been making a lot of effort to set up this response back in 2015 and 14. And then, you know, we were trapped into like much more granular detail of intervention. How we do address the migrant, undocumented migrant. How do we address the problem of not Syrian refugee? How we do address the problem of Jordanian that are not under social security? Who's responsible for that? Who's ready to fund those politics? And all those things needs to resume. Those dialogues, I think, were happening, but a bit staggering. Now with the COVID, there is an opportunity to speed up the process. And INGO are very welcoming. And I think really, I mean, I've been here only since September, but I've witnessed a very change in the perspective and the way INGO were looking at this crisis. And the COVID confirmed that. And really, like, now they are all talking about how we do a proper transition, a proper comprehensive planning over the next 5 to 8 years, and how we do integrate localization into that. But let me just do a small thing on localization. Localization is a big word. This is a worldwide, everyone talks about it. This is a very, let's say, UN-led process, and so full of good intention. But at some point, you have to take the very sensitive things around localization, which is whose donor is ready to really switch the funding to more a localized partner. How many localized partners have the capacity to carry on activity? What are the guarantee that there will be no let's say, no risk for those civil society running some very sensitive program around protection, for example. So all those things needs to be discussed very concretely. But also, I mean, you know, I've been growing up in Ramallah when I was a kid, and I'm very amazed that Jordan didn't become the capital of the competence for aid delivery within the region. This is the most stable country. That should be the place where we can train lots of people. And when I say train, I'm not talking about those 2-3 weeks training. I'm not talking about master, doctorate, real and concrete training, use the INGO and the UN presence to build up those capacity. So also that would be much easier, let's say, to have a localization agenda that move forward. And so there, I think that's really the key, and the effort are there and needs to happen. We have, and as said Dr. Yusuf, we have to be very careful not to jeopardize the existing support aid plan that were existing, right? We just have to refer to them and adapt them to the COVID thing, because the issue are the same. So let's not reinvent the wheel or whatever. We just have, I think, really to update what we have, be a bit more collective, leave on the side of small conflict, and really try to come up with a broad, comprehensive national plan for Jordan, especially, to really have the best outcome we can in the next few years. You know, in a country, when you have all of a sudden the donors representative, the UN representative in the country, the government, the INGO and the NGO saying the same thing towards the capital of the main donors, usually you get success in terms of raising funds. If you're still too much opposition and too much conflict around, then it's really hard. If we can get those consensus all together, then there is a chance to get some additional fund, or at least to prevent any decrease in the coming months. Over to you.
Baptiste, thank you very much for that comment, but I would like you also to talk a little bit about the Brussels conference and supporting Syria, and what's your role in that, and how do you see things change in light of the COVID?
Well, first, the methodology for the civil society consultation around the Brussels IV is, I'll say very frankly, a bit disappointing, right? Because basically that should be only an online survey. Our job as GIF has been over the last few years to basically facilitate the civil society consultation, to feed back into a report that we submit to Brussels. Last year we consulted, I think, 353 CBOs, international partners. This year, because of the COVID and because also I have huge gap in my team, and no nice things to say, I'm alone currently. The idea was just to update last year's report, a bit aligned with what I was saying before. We are not, we are not reinventing the wheel. So we will update the report with the achievement, and we will put for every sector the COVID impact we witness and the COVID risk we think might impact negatively the Jordan Compact over the next few months. So this is what we are doing. And on the regional perspective, I mean, to be very honest, the inside Syria is the top priority. So I'm getting a little bit away from Jordan, but the real solution for Syrian refugee crisis is to have them being able to go back home in a safe, protected environment. We all know that, and it's very challenging. It's highly political, but this is the key. And right now, even cross-border operations for assistance are, very at risk with this resolution issue. So that should be more or less, I guess, and we are comfortable with that. That should be one of the focus on Brussels, is to really try to solve this political problem, because the only solution for Syrian refugees at long term is really having them able to go back and willing to go back to their home. Do you want more? Because I think I can't elaborate more. As we are writing the report. So unfortunately, I don't have yet all the detail, but that will be released June 4 or 5, if with Sama, if we work probably all overnight on it. But it will be, of course, shared with everyone. So we'll be happy to share with you.
Thank you, Baptiste. I think it is very important to think about how we can prepare the Syrians and support them to go back. And as you said, part of it is the infrastructure, the safety, having something to go back to, but also building their skills to be able to go back and build their country and build their confidence that they are part of this rebuild. And we hope that the international players take it seriously and maybe in light of the COVID see the importance of peace in the region, whether it's in Palestine, whether it's in Yemen, whether it's in North Africa, Libya, or in Syria, Iraq. I mean, so much money has been wasted in the strife, and we really need it now, especially in the light of the COVID, in helping the economic situation. Wars are just killing us economically, and I think we need to reinvest in peace building and in rebuilding our countries and getting our economies going. I'd like to go back just for a quick round of final remarks because it's now 5:47. So Maha, any few quick remarks, and then Tewodros and Sven, and then Dr. Youssef, and lastly Baptiste. Maha?
Yes, I would like to, to have one remark on gender, because already, and I see that we received also another comment on gender. As you know, from the methodology that already Sven, Eric, and Tewodros explained, that we are relying on available databases. So it's not a representative, nationally representative study. So it's really reflect the situation of those in these databases. And because these databases that we rely on in Jordan, for example, are mostly from ILO program, which contain around 35,000 records. Mostly from employment centers, EIIP, employment intensive infrastructure programs, skills. So in those databases, so women, they are most likely to work formally, because they are supported by programs. So to have, to be placed in a factory or in a workshop and having a contract and at least a minimum wage and so forth. So this is, we don't have, at least for this round, we didn't have a database where we can include, for example, women working in health sector. Because here, as you already mentioned, Dr. Sawsan, that we have really impact on health workers, or women working in teaching, for example, as teachers, because here we have, however, we found that women during the crisis, the family responsibility increased. And this is also comparing to of course, we have more women with paid leave, but at the same time, they are working while they are on leave. So it's different than, but at the same time, we found that also men, they started and their family responsibility increased, and mainly childcare. So I think what we can do maybe for next rounds is to expand a bit our databases, where we can include other dimensions, and especially other gender or women working in different sectors, where we can also see the impact. Gender violence, to be honest, we didn't tackle gender-based violence, because as we said, this is a rapid assessment, phone call survey. Each questionnaire shouldn't take longer than 20-25 minutes. So the average in our case, it was 22 minutes. So we need really to be very, very selective about what we would like to include, but we are open, as I said, in the next rounds to include other dimensions. Thank you very much.
Thank you, Maha. Tewodros?
Yes, thank you so much. It's been a very useful exchange that we've had. I think a couple of remarks that I would like to make. I think the last one is just to reinforce the fact that, there was a couple of questions about the methodological approach. Yes, it was a telephone survey that was conducted rather quickly. And my final remark would be really about, as we are trying to grapple in understanding how the pandemic affects, partly manifesting also previous vulnerabilities that was mentioned earlier in the system. I think, and also to have appropriate responses and all of the discussions that we have in terms of a type of support to substantiate that with evidence that matters becomes key. I think this is also the reason why we have set up this initiative in a manner. Is not only a one-time exercise. This is just, the starting of, what we wanted to do. And basically from the point of view that there will be a lot of initiative, a lot of directions, a lot of claims, but all of this has to be substantiated with evidence. And we're positioning ourselves and our initiative in a manner that provides more grounded information, knowledge that is relevant for policy and advocacy that we are been discussing about throughout. So I think what I say is stay tuned, we'll have more to come about, but it's also important even for the various actors to keep in mind to ground our assertions, to ground our claims, to ground our policies with evidence. That's pretty much the remarks I have. Thank you.
Thank you. I think the importance of evidence and data has been highlighted throughout. How can we distribute things if we don't know who who needs what, where they're located, what their need is, and so on. And we need it quickly. We need it live. We can't just have it. It needs to be dynamic, the data. And this is where technology plays a role. But at the same time, I keep telling people we need to have two plans, emergency plans, one with technology and one without, because we never know whether technology sometime will fail us. And then do we have systems in place to be able to deal with that? Moving on to Sven, if you have any final comments.
Yes, I just came to think of one thing that actually, I mentioned that a crisis like this, they consolidate or they increase existing challenges in the system. And one thing I came to think about, and which to me was a very interesting result from the survey that we did now, is that most of the micro, small, medium enterprises, particularly the micro and the small, are unsustainable. Results from both Lebanon and Jordan shows that approximately 1/3 of these enterprises, they lose money. 1/3 only have a surplus, and the rest, they are kind of break even. That means that perhaps about 50% of these is what you can call sustainable. And it's also interesting when we asked these enterprises what they requested of support. Many of them pointed to support to develop business plans. And that's kind of surprising because it's so easy to ask about cash in this situation. But this was a more long-term perspective, which means that they also have, you could read from these results that there is a need for helping these enterprises run their business rather than developing just their skills. Skills is one thing, running a business is another thing. And that goes back to Dr. Yusuf's comments also on the perhaps lack of focus on these smaller enterprises, micro enterprises from a government compared to the larger enterprises, which could be kind of a systemic interesting point as well. And this is one of the things that have been exposed, I think, and which is interesting for us to follow up. And also on the same thing is also to look at how this will affect the initiatives that were going on before the crisis started. You already mentioned the compact. How will this affect all the plans and good intentions behind the compact? The other thing is initiatives to include women into the labor market, to decrease the youth and unemployment, and there are lots of good initiatives. And it's interesting to see how this situation will affect these initiatives in the future.
Thank you. One important thing is also in Jordan with the SMEs that women work in. A lot of times, sadly to say, women take loans for business projects and then they use them for personal reasons at home and so on, and they fall into debt. The other issue is that I think people need a one-stop shop, meaning that they need to go to one place where it will help them write the business plan, help them know how to get the loan, and then if they have any products, how to package them, mark them, and get them to a marketplace. So a lot of times the support is fragmented and people don't know how to get to it or know of its existence. So this is one issue. I'm going to ask Dr. Baptiste to talk first, and then we'll final comments from Dr. Youssef, just to wrap things up together. Baptiste, if you have any final few second comments.
Yeah, I'll be very short. You know, I've been working 18 years in acute emergency all over the world. Name a disaster, I was probably there. So the COVID is an opportunity to come along all together. I know I repeat myself, but I do think that's the best way forward. Let's really come together. I would welcome regional and national plan and broader consultation where everyone can play. I think there is room for more efficiency within the existing response we have currently running. So that would be my call. I mean, and it's a very call from a forum, right? We are very into collective engagement. So I do believe, and that's the message we pass to everyone we talk to, but I do believe that's the best option. And I hope that by September, we can have some national dialogue that will kick off based on existing things, not reinventing the wheel, really based on existing things, but really to come along and assess all the existing resources to have the best response, the best support we can, especially ensuring no one is left behind. Over.
Thank you, Baptiste. Dr. Youssef, two minutes or 1 minute even.
Thank you all. I'd like to point out that an anomaly in the study that said that there are clear signs that more women than men had been granted paid leave and that fewer women than men had been permanently dismissed. It points out to the fact that more women are percentage-wise are employed in the manufacturing sector. I think this was due to the first thinking on the London Compact. When the government was looking at employment opportunities, they immediately looked at the garment sector. And the garment sector is, I think, is just the type of employment that's, it's a garment sector. And so, and that's probably why more women are attracted there. So maybe one should look at the distribution of women in industry and their type of work. It's just a quick note on the report. I have tried to paint, I hope, a clear picture. I hope it wasn't too bleak, but my sense and purpose is to insist that we have to act with urgency. We have to act with a great sense of urgency, even though we don't know how this COVID-19 will work out, at least in Jordan, which is my area of concern. So please, whenever we think, we should think not long-term plans, long-term actions. What we're talking of is a span of a year and a half, maybe two, and think about the permanent damage that may occur and the distribution of the damage across the country. That's all I wanted to say. Thank you.
Thank you, sir. One point that I really want to emphasize is, sadly to say, with the COVID, which has promoted, of course, isolation and distancing, and even countries have isolated themselves, and we've seen that in Europe. There's been competitiveness regarding getting equipment and hygiene kits and so on, and, you know, people competing and stealing, countries stealing from each other. And I think this is not the time for that. This is a time where we really see, and you have emphasized it all in your works, the need to work together, the need to work internally together, the government with civil society and the private sector, the need for the countries of the region to work together and complement each other, and the countries of the world to work together. Without that, COVID will defeat us. And this is a global pandemic. It has affected us all. If we are talking about bouncing back, we have to think of bouncing back together, where we are not bouncing and stepping on people and obliterating them, but working together to bounce back and really carrying the whole nation forward. I would like to thank you all very, very much. It's been a very quick 2 hours, especially today in Jordan, where everybody's so busy in running around getting things ready for the Eid, which again, we're going to be social distancing. I'd like to thank Maha, Kattaa from ILO, Sven, Steve from Fafo, and Tewodros also from Fafo, and Baptiste, Hanquart from the Jordan INGO Forum, and last but not least, Dr. Yusuf Mansur. I'd like to thank ARD for organizing this dialogue and really supporting it. And we are hoping, of course, for this, the content of these dialogues to be brought together in a publication, so that it's not just dialogue, but that it is lessons learned while we're living the crisis, and it could be documentation when we look back. And hopefully we will look back being in a better place. So I'd like to thank you all very much. Eid Mubarak, or we hope to see you soon without the social distancing and be able to continue building upon what we have discussed. Thank you very much, and we'll see you soon, inshallah.
Thank you. Thank you very much. Thank you.
Eid Mubarak, everyone.
Thank you, everyone.
Thank you.